say that you wanted to. Dr. Mahendar, you had asked to show a PowerPoint.
Just got like 5 or 6 slides I'll just do very quickly. So these slides are based on a lot of students and parents that come onto the academy and asking the questions, right? Well, first of all, let me congratulate on becoming doctors. Even today, with all the ease and difficulty, it is still difficult. What is the most important thing in your preparation for the future? Competitive exams, future career. Anyone? What do you think is the most important thing? It's not intelligence, it's not hard work, it's not dedication. It all boils down to only one thing: consistency, and consistency alone. You have to have consistency. You might be sitting on burning your midnight oil in 18 hours hard work you might be putting in, but that's not going to help you. You split it into 3 hours a day and spread it over a week. That is better. So you have to be consistent with everything that you want to pursue. Consistency with your teaching. You go to the classes. One good professor teaches, you go there, the other one doesn't teach, ignore it. No. You will learn, even if he is not the best of the teachers, you'll learn 2 points, and that 2 points will be enough. You'll be having a pattern. You're training your genes to accept a pattern. That is more important by being consistent, right? You're increasing your endurance, right? With your preparation, study hours, with your practice tests, and with revision. The rule is, if you can't revise a subject or a topic, the rule is don't read it. The rule is, if you can't revise something, don't touch it. You're wasting your time. After you finish your house search and say how much time you think you have, you maybe at best have 6 months or 1 year before you crack an entrance. If you did not finish in 5 years of studying, you think you'll be able to do it in 1 year? I don't think so. You can't think so. So your time is going to be precious. I again reiterate, 3 years after you finish your house science is the most valuable time of your life. So plan it, and every minute counts. Don't waste a minute. If you can't revise something, don't read it. You rather let go, because you're losing something else, right? So with all that, it is very important, right? Things that you should not be doing. No matter what happens, don't get depressed. Like the panel has thrown out so many options that you can pursue. So it's not end of the world. The effort and time that you're putting into this field, you put it in any damn other field, you will excel. Including civils and name it, you will excel. So don't ever get depressed and never spoil your health. It's not worth it. That is much more valuable than whatever you think. It's only when you lose it, then you realize it, right? Never burn midnight oil. The only person in a library in the US or UK that you see after 6 p.m. is an Indian. Mark my words. And nobody else is there in the library. Either they're in a club, they're in a pub. And tell you what, they're not inferior. Those are the guys that write our books and we read those books. So it is nothing to do with spending more hours. It's how effectively you grasp things. So as I was saying, 3 hours a day, all your life is not what you need. Not 10 hours, 20 hours, right? So inculcate that style. That is always important, and that will make it pleasurable for you. If you've done your Robbins, open up the Journal of Pathology, right? If you're done with your medicine Harrison's, open up to date, right? There is always something for you to read. So, and never burn midnight oil. And don't assume your senior's advice is always correct. Oh, what books have I to read? Oh, what subjects have I to read? Ignore. Just read physiology. There are more questions. He's saying this because he didn't read physiology in his undergraduate days. But you might not have read anatomy, right? So don't just assume. If you have to take advice, take the advice of seniors that have failed. And never give up. You've come halfway. You have to go forward. Absolutely, you have to go forward. And there are ways to come around that, right? The common pitfalls that I've observed in this system: lack of planning and a timetable. The most important, there is so much for you to do in such a short time. Unless you plan it and have a proper timetable, you will not be able to execute. Well, everybody says India plans so well. India is a country of planning, but it doesn't execute. No, India is not a country of planning. India is not a country of planning, because if you plan something that you cannot execute, problem is with planning. You're planning something that cannot be executed. Problem is not with execution, right? So planning is very, very important, right? Then lack of adherence is not enough that you plan. You have to stick to that. Make sure that you comply with your timetable and finish off the topics. Avoid the herd mentality. Like somebody was saying, do this, you get that. Do that, you get that. You decide for yourself. You go with your heart and then go with your mind. Analyze the things. Take inputs from your faculty. Take inputs from seniors. And finally, the decision has to be yours. Don't blindly follow anything. And you see, the weak base in foundation is a fourth point. What does that mean? It means that there is room for you to get better. Even if you had not done your job in these years, there is still time for you to sit back, study, learn, right? So never think that you have a poor student in your MBBS, you can't come around. You can come around. That's very, very important, right? And avoid the rigid thinking. This is, a lot of times rigid thinking is because of lack of confidence, right? And insecure feeling. The rigid thinking is because of that. Come out of that, right? And plan B is very, very important. Let me throw 2 minutes on this. Whatever you do, because you're all young, you have not seen the world enough. I'm telling you, people that are aspiring to go to the US, people that are wanting to go to the UK, make sure you have a plan B. It might never work out for you. But as much as I encourage you to go to the US and UK, I should warn you, for any reason you might not go there, right? So have a plan B. Say you realize after 5 or 6 years that you're not able to get to the US. Where are you? Your colleagues would have finished their MD and they're ready to take on the DM or through the DMN training, and you can't go back and study for the PG, and nothing is going to get better in the next decade. So alternate plan is always important. That is true for the people pursuing the AP Indian PG and for the US and for the UK, right? Well, there are other careers like we were discussing, DNB, and it's surprising that these are all, coming onto the same line, right? DNB India is excellent. Don't think that it is not worthwhile. It is worthwhile. MRCP now can be done from India, all 3 components, and it is recognized by the government. This is one exam you can do while you're working as duty doctors. Then USMLE is still an option. Research, but again, primary qualification, postgrad qualification is more important. Administration, hospital business, not just administration in the hospital. There's a lot of things that are around hospital business. We will not get into those things, but I'm saying there is a lot of scope there too. Like trading, getting the equipment. There's a lot of hospital related business that is, big money too. Then quickly on the MRCP, because I was putting the thrust towards it being an option B, right? Part 1, Part 2 PACES, all can be done from India. It's exam, right? Chennai and Kolkata have now got defined centers for the practicals. All parts are conducted 3 times in a year. For some reason, you're unfortunately losing the exam. You can do it again without losing much time. It is expensive, but still there is a provision for you to do it. It can be clubbed with any preparation. You're preparing for your Indian PG, you can still do the MRCP because MRCP is a single subject, only internal medicine, right? And 30% of your questions in the AP and PG or the AA, PG or DNB are going to be medicine anyway. So you can do that both. And 18% of questions in MRCP are basic sciences, which you will be reading for your Indian PG. So that is an excellent option actually, right? And that is again, US, wanting to go to the US. Do your Part 1 MRCP after you finish your Step 2. Step 2 of USMLE and Part 1 MRCP are the same. Then you can't get through the residence in the first year. Finish off your MRCP. You get to US, you go. If not, at least you've got a PG, right? So you can be working while you're doing the MRCP and earn and pass. So this is very important, right? Then finally summarize the last slide. The last slide, most important things, early start of preparation, timetable, rigid choice, and right group, and be consistent, have a plan B. And my last advice is don't stay away from patients in the name of preparing for PG. I see lots of people are sitting on for a year, 2 years, 3 years. That is wrong. If you can't get something in 2 years, the chance of you getting for the 3rd, 4th year is very, very slim. Get back to your patients. Maybe you have to remember what Einstein said. What is the definition of insanity? Doing the same thing again and again, but expecting a different result each time. It doesn't work. So you have to do something different. Maybe you have to get back to the patients, start seeing the patients and prepare. Or maybe you have to take a different route. Thank you all.